I'm Dr. Ross Jenkins with Caldwell Foot and Ankle. I'm here to talk to you about insertional Achilles tendonitis. What insertional Achilles tendonitis is some people have pain in the back of their heel. And it's typically, when we're looking at the calcaneus bone, if we have the Achilles tendon, it attaches about midway through the back of the heel. And what people come in complaining of discomfort about, they'll get a big knot on the back of the heel and have lots of pain in the back, and it hurts with and without shoes on. And that becomes important to determine because there are other factors that can cause pain in the back, but this is probably the most common. We typically see insertional Achilles tendonitis in people with higher arches. And the reason that we have that is because people with higher arches, if we have an Achilles lengthening or Achilles that is attached to the back, if that same Achilles length with a high arch foot, it's tighter because of the position of the rear foot. If we're flat-footed, it's not as tight. So what will happen over time, because of being athletic and moving and those types of deals, that tendon is pulling tension onto the back of the heel. It will usually slightly pull away, and the tendon is attached to bone by what are called Sharpie's fibers. And Sharpie's fiber is attached to what's called periosteum, and periosteum is kind of like clothes on a bone. And when that tendon pulls off, it will microbleed into the region, and progenitor cells in the blood thinks it's supposed to be bone, so it'll make a spur on the back of the heel. And typically people develop a knot. And then they get severe pain in the back of the heel that hurts all the time, and you'll typically find that wearing a heel or something like a cowboy boot or something feels a little bit better because it takes the tension off the back of the heel. The treatment for this primarily is usually ice and light stretching exercises and decreasing your activities to help with the pain. Sometimes we have to force to immobilization to try to relieve the discomfort. Physical therapy is a good adjunctive tool as well. And of course, if all else fails and we cannot get it better with conservative management, then it is surgical intervention. Now, typically the surgeries will vary, and I found in 22 years of practice that we are now using a particular device that is absorbable, and it actually gives us a larger footprint for healing on the back, and we use in what's called an Achilles boot, so I typically can walk people at about 2 weeks post-operatively. We've found in some patients that we do what are called flexor tendon transfers, which means I take a tendon that's not associated with the heel and that's actually associated with the big toe that pulls the big toe down, and I'll transfer into the back to give better blood flow and better strengthening to the back of the heel to aid in mobility. But the idea with this particular procedure is to make you pain-free for the rest of your life and keep you mobile. I think the idea with anything that we do, everything that we do at Caldwell Foot and Ankle is try conservative management first, and only if conservative measures fail will we consider surgical options for you. But again, the idea is to have a good quality of life. I'm Dr. Jenkins. Today's topic was insertional Achilles tendonitis. I am with Caldwell Foot and Ankle.